So I am actually qualified as a dentist, and I know what you're all thinking. How did she get from teeth to aesthetic medicine? And it was a very long journey, I have to admit that, but it was a very interesting one. I realized a lot about what I do want for the rest of my life. And I've taken on lots of different training positions, and one of them that I found particularly interesting was a head and neck surgery position. And I did this within the Royal London Hospital. I was a senior house officer, and we saw many cases, many trauma cases that we had to treat surgically. But this one case in particular truly resonated with me. It really hit hard. And this was a stunning 32-year-old female who was walking home from work, from the tube station after work, and she was assaulted by her ex-boyfriend. And she suffered many injuries, and she had multiple surgeries for those injuries. And the final surgery was actually scar rejuvenation. And that was to repair the scars that she'd had as a result of previous injuries. And I was the doctor that was in charge of taking the consent from her for this operation. And when I was doing so, she looked so disheartened, and she said to me, "But it's not like I have a choice, is it?" And when she said that, that really hit home. It made me realize, wait, does she have a choice? Why does she say that? And after that moment, I started to reflect on the fact that she did have a choice. She did. She had the option of undergoing a lot of stress for her body and having a surgical procedure carried out, which is very daunting, very scary, very permanent. And the chances are that the scar may not completely disappear as a result. That's one option. The other option is to just accept it, to do nothing, and to be reminded every time she looks in the mirror of that horrible incident, and to avoid taking photos or covering her face in such a way so that this scar is not noticeable. And when I thought about it, I thought they were horrible options. And so I started to do a lot of research to find out for more conservative options and a middle option, so that patients can have a choice as to what they want to do. And it's something that can help everything. So if it's a scar on the face, it can help all of your face. It's not specific to just a scar. And it's something that you can do at home. It's something that you can do in your own time. It's something that you can attend the clinic treatments, and you are supported through the whole journey. It's not a matter of you have an appointment, you have the treatment, or you have the surgery, and that's all. And this is how Skin Envy was born.